Hi, my name is Les Miller. I'm age 71.
I'm his lovely wife, Lauretta Miller.
Was treated here at Envita for metastatic prostate cancer. So most of our adult lives, or virtually all of our adult lives, we've been very healthy, been very blessed with the ability to carry on without any prescriptions. Then along came this prostate cancer that popped up actually sometime before, but most recently in October. I had no symptoms. I simply had a physical, but prior to that physical, 6 years before, I had a prostatectomy because I actually had an elevated PSA, which led to a biopsy and the recommendation of removal, and that's what was done by robotic surgery. Everything was supposedly clean, and got a very surprising result in October of 23 of a PSA test. There was a number of years over which there wasn't a PSA test because it was deemed not necessary. But this one, my recent doctor said, "Oh, we should do it," and there was a very elevated. Yep, it was 190 PSA, so it indicated something serious going on.
Yes, we went very dark. You know, I mean, we have a real strong faith, but we went dark. It was hard. It was hard. But through that, we had our faith. So, but it was still hard. Did a lot of crying. Like, what does this mean? You know, we think this is the end. You know, we've known a lot of people that have gone through conventional stuff, and yeah, that's what we thought we were facing.
So then there was a referral to the cancer center in Fort Wayne, Indiana, near where we live, for a large cancer institute, and good reputation, all that. And testing was set up for all the scans, the CT scan, bone scan, and all that. And a first visit was scheduled for November 1st for the oncologist. And through that, at the point of the bone scan, we saw I lit up like a Christmas tree. So it was well established in the bone, and you know, to me that was really not a good sign. But I resisted as much as I could not to go dark and go flat. We had, as Lauretta mentioned, we had a couple of pretty tough days in just processing that information and the specter of receiving the treatment, because so many people have been destroyed by conventional medicine.
He has an aunt that was a month younger than he is, went to school with him and all that such. And she had found out she had cancer 3 years prior to this, to his, and she passed away using conventional. So, and it was miserable. Her time was pretty miserable. So we were kind of looking at that too, like, ah.
On the day of the first visit to that oncologist in Fort Wayne, I said, why am I not considering something in the way of alternative medicine? So I, early in the morning, 6 a.m., I'm up that day, got on my computer, and the first thing that under alternative popped up in my view was Envita. So I reviewed a few videos that got my attention. I saw one man and his wife looked just a lot like us.
Yeah.
Very similar case. I'm on, okay, I gotta look into this. So I'm an engineer by education and background and life. So I drilled into the science, and it made sense to me. And I actually called Lauretta and said, "Hey, you know, you've been struggling with that word hope. Here's hope." I pointed at that computer. I said, "Here's hope." We carried on that day, did our visit to the oncologist, which didn't go very well in terms of the way he presented and all he proposed. And I went home and immediately picked up the phone, and I called Nick Tribuco here at Envita. And from then on, that's been the way I went. It was the fact that it was all solid. There wasn't anything that sounded hokey or suspicious or didn't make sense to me.
Yeah, I was probably a little more hesitant in all of this. My world's the natural world, but I knew we needed a combination of the two. And I've said for decades, the two need to come together. And that's what we have here.
So we loaded our car and drove 3 days to get here.
Talk to me about that initial consultation. Like, tell me about sort of your impression by the end of it.
Well, so there was a wealth of information thrown at us, all of which I say, okay, they have all these approaches, so many different approaches to attacking the disease, and at the same time, reinforcing your immune system. every step we took in the journey, it I kept getting reinforced with the fact that this is the right way to go. It makes a lot of sense, and it's proved out. To me, it's proved out.
I know that a lot of patients outside of here in the conventional world, chemo is very tough. Not so much the case here. Tell me a little bit about it.
Well, in my particular case, absolutely not the case. On the day of treatment, the day after treatment, I really don't feel any impairment. I never became nauseated, and the technique is just fascinating. Their technique of applying it using 10 to 15% of the normal dose. I have to say it was so much more than I expected, because you don't go in thinking that you're going to get some chemo treatment and not have some serious side effects, but I really didn't. I have to say, I tell the staff all the time, the toughest part, the science was great, but the people make me so enriched my life. And they are so knowledgeable and so compassionate. It's just fantastic. Universally, across all levels, it's just been an incredible experience. And I've asked any nurse any question about any phase of it, and they know their stuff. So I can't say enough about the staff. So I'm at the end of the end of the treatment in here in the facility. One more day, and then we're off to return home. But we'll continue on the home care version of that. We've got a whole plan worked out.
Well, we met with Sylvia for the home care, and just the wealth of information that she gave us was wonderful, because it's hard leaving this beautiful bubble, umbrella, whatever you want to say, that Envita has, such great care and such. So, it's a bittersweet type of thing here. But she presented all this to us, and, we had gotten the handout and read it, and it's just so good to know that we're not, here you go, goodbye, that we're like, we've got you.
Drill down into the information that's available, and make a phone call and talk to people. Talk to as many people as you want. The people here at Envita, totally open, totally genuine. They're not trying to hide anything. And I believe you'll find your way to the doctors and the treatment you're looking for.